Let's talk to Mike Adams, who's the Director for England of the Royal College of Nursing. Mike, we saw some of the stresses and strains and the emotional toll that this is taking on the nursing staff. Just talk us through how your members are reacting and how they're coping with this, especially this difficult strain which we have now.
Yeah, well, it's not an underestimation to say, our members are in real dire straits and really feeling the pressure, and it is a bleak picture for them personally and emotionally, but obviously for the people that they're trying to give their best to care for as well. It's a system that's under incredible pressure. Your report there highlighted, tragically, that the care that people are trying to deliver and the circumstances they're working under, and I think we all saw there the emotion that the nursing staff are working with.
And we saw especially one nurse there who has herself become a patient. This must be taking such a huge toll on your members, both mentally and physically, when it comes to doing the job. How much more can they take, and how close are we to a possible situation where we will have ambulances queuing outside hospitals?
Well, I think we have already seen that this winter, and unfortunately we see that pretty much every winter, and this is why we and other professions have been highlighting the need for serious funding into resourcing staff within the NHS and within the wider healthcare system for several years. I remember doing a piece highlighting corridor nursing January 2019, and now we face a pandemic with more demand than normal, with a shortfall of nursing staff to start with, and now this huge impact of as we're seeing our own nursing staff becoming ill, needing to isolate, and also them caring for each other. It's just a perfect storm really of pressure, and a situation that no one really ever expected to be under, in any of our professions.
And given that nurses very much are on the front line when it comes to this dreadful disease, do you have enough in terms of the figures, your head count? Do you need to recruit more? And ultimately, are they paid enough? How much do nurses get paid, an average nurse now?
Well, no, we have not got not enough nurses. We went into the pandemic with around 40,000 vacancies within the NHS. That is an incredible amount of people that are missing. Those vacancies are made up by normally nurses taking on additional shifts to help their co-workers, and the government has to take some serious action to recruit more staff into our services and then retain them. We did a survey last year in the first wave. We had 40,000 members respond. A third of them were considering leaving nursing, and pay was their number one concern. An average nurse now, if you compare their position now and a similarity of where they were 10 years ago, point for point, their pay is in real terms 15% less than it was. This has to be addressed by the government. The nursing profession will not tolerate this moving forward. They cannot be left in this situation.
Mike Adams, the Director for England at Royal College of Nursing, thank you so much for sharing those figures with us. Thank you.